My name is Pam McPherson. I'm the VNA Hospice liaison here at Cape Cod Hospital, and I've been here a little over 10 years. So my role here as the hospital liaison is to present to families how hospice can really help them experience the end of their journey and connect them with the services that's going to facilitate their quality of life. I generally receive a referral from a physician. Sometimes the family requests it, but most often it'll come from a physician who will see someone that they think may qualify for hospice and will want me to take a look at that patient and determine, do they indeed meet criteria for hospice? And then, of course, are they interested in hospice? So I meet with families, talk with them, walk them through the process, answer their questions, but most importantly, meet them where they're at. So one of the first questions we'll ask is, what's important to you? What do you value? And then we kind of shape our conversation from there. So it's really important for them to know that they can not only choose a hospice, but have a sense of what is going to happen when they get home. And we sit and we talk and we paint the picture, and I leave the room and they just say, I feel so much better. I'm calm, I understand what's ahead of us. If they choose to go to palliative care first, or they've been on palliative care already, that is a nice transition because we work closely with the palliative care nurses at the VNA so that it's as seamless a transition as possible over to hospice. And that's very reassuring to patients to know that, to kind of get it started here in the hospital and they know what to expect when they get home. We'll order equipment, we make sure we send medicines home with them so that if they experience any symptoms upon arrival at home, shortness of breath, anxiety, pain, whatever it is, they have those meds right in the home from the get-go. The equipment is all set up the day before or usually the morning of their discharge. Many people think that when any hospice comes in that they bring in 24-hour care, and that is not true for any hospice. So we have to make sure that there are caregivers at home that understand what is going to be expected of them. We'll walk them through what it would look like to hire private care, and we give them agencies that they can select from. We don't select for them, but we guide them on that. So really the whole piece of them going home, we are part of. That's another real advantage with VNA Hospice, is we make sure that there is a nurse there the day of discharge. Our nurse is there and goes over everything, gives them all the phone numbers, who to call, these are our services, starts the plan of care in place, when the home health aide will come, when the chaplain will come. And the other thing is they can call us 24/7. And I always tell them they're going to get one of us on the phone. They're going to get one of us who has real-time information in front of us that will be able to help them. And if we can't help them by phone, we will send a nurse to the home. And it doesn't matter if it's 3 in the morning. A nurse will come to your home because our commitment is to keep the patient comfortable, to let them stay home and not have to come back to the hospital, and to support the family. So there are some patients that cannot go home. There just is not a caregiving situation at home. So they may be going to a nursing home or to a skilled nursing facility. So we certainly provide hospice care there as well. In that scenario, the day-to-day care is provided by the staff at the nursing home, but we still go in as a hospice to make sure that the goals of care are still consistent with hospice, that they are still comfort measures only, basically. It's a real community spirit that we have here, and we feel like we're caring for one another. And you bring a lot of yourself into that when you know you're caring for your friend's mother or father or sister or brother. And it is really a privilege to be able to enter this part of people's lives. They've been given the worst news that probably anybody can receive. They don't know what is going to happen. They are terrified. And just to be able to sit with them, to hear their fears, but to be able to say, we got this. We're going to do this together. You're not going to be alone. We're going to walk you through this. I think the thing that I've learned the most is that joy and sorrow are not mutually exclusive. They exist at the same time in the same place. That things can be beautiful and things can be terrible at the very same time. And to find solace and peace in that, it is a challenge, but I've learned it in my own life, and I see it in my families all the time, that I see reconciliation happen. You know, people speak to each other that haven't for a long time, and words of goodbye, or I love you, or I forgive you, said when they needed to be. It's a beautiful time, although be it a very hard time and a very painful time. And that's what my patients have taught me, that joy and sorrow are part of the same fabric, and we experience them together.